Perfect. Good morning. My name is Mr. Sameer Trikha. I'm a consultant ophthalmic surgeon based in the Harley Street district of London and also in the Circle Hospital, Runnymede in Surrey. I specialize in cataract and glaucoma surgery. And this morning I'm going to talk to you about types of lens options that we have available following cataract surgery. Now, when the natural cataract, which of course is clouding of the lens, is removed from the eye during cataract surgery, a number of different types of lens options are available. These are artificial lenses that can be inserted into the eye to give patients a desired prescription and, importantly, improve the vision in the eyes. Now, there are three broad categories of types of lenses that you may wish to consider. The first type is what we call a standard lens for the distance, known as a monofocal lens. Now, this type of lens tends to give patients excellent vision for the distance, but it does mean that there's a requirement for reading glasses for intermediate work, or for example, near work, such as reading a book or looking at text on a phone, for example. This lens is extremely safe with a very low side effect profile, but as I mentioned, does mean the requirement for reading glasses for near and intermediate. The second group of lenses are what we call extended depth of focus lenses, or EDOF lenses for short. Now, in contrast to the first group, these lenses give very good vision for the distance and also very good vision with a better range of vision up to intermediate. And think of that as, for example, reading on a computer screen. However, for anything closer to that, within a sort of 45 centimeter range, there is a requirement for reading glasses, albeit at a lower power. This lens tends to be very, very effective and works very well for patients who may wish to consider that better range of vision given their pursuits and their daily hobbies. In contrast to the first group, however, there are some small risks associated with this lens, which can include the development of certain visual phenomena, such as glare or some halos around lights, although generally this is fairly low, with about 5 to 10% of patients developing these problems. The good news is, in most cases, these effects wear off after a period of 6 to 9 months or so. In the third group, this is known as the multifocal lens group. And this is a group whereby the type of lens inserted into the eye permits good vision for the distance, good vision for intermediate, and good vision for near work as well, such as reading a phone or reading text in a book, for example. So this really is the best lens option if patients are considering or wish to be spectacle independent, and gives the best chance for them not requiring glasses at any distance. However, in contrast to the other groups, there is a slight risk of developing glare, halos, and starbursts in the vision. And this is a slightly higher risk compared to the second group, in about 10 to 15% of patients. Again, in most instances, it does wear off over time, and so patients tend not to have these problems after a few years, but in a certain number of patients, it can still persist. And think very carefully is my advice about choosing this type of lens. Furthermore, in the multifocal group, there are should I say, a few occasions where patients do require reading glasses still, and that may be in areas of dim light, for example, if they're reading a menu in a restaurant, for example, on an aeroplane, trying to read a book with the lights dimmed in the cabin, for example. So generally, a very good lens to be able to permit spectacle independence. In most instances, there may be a few occasions where glasses of a low power may still be required. Generally, the lenses are all very, very safe and work well. However, it's worthwhile mentioning that certain types of lenses may not be the most appropriate for individuals based upon previous eye conditions. For example, patients who might have glaucoma tend to suffer from something called low contrast sensitivity. And that's where the ability to differentiate types of colors, like shades of gray or red or blue or black, is slightly impaired. Now, in the third group, the multifocal group, what can happen is your contrast sensitivity is impaired slightly anyway because of the nature of the lens. And so I don't tend to recommend the multifocal lens group in patients with glaucoma. Similarly, I don't tend to recommend this type of lens in patients with macular degeneration, where the central macula may be affected as well. So generally, The lenses are very safe, but do consult very carefully with me in terms of the type of lens you may wish to choose. A final point to mention is of something called astigmatism. And astigmatism is whereby the natural lens of the eye, or should I say the eye, is shaped a little bit like a rugby ball. And of course, the benefit of these personalized lenses is they can be corrected for astigmatism as well as near and long sight. Okay, so just a word about the types of lenses and suitability for individual patients. Now, whilst all of these lenses are very safe and have a relatively low side effect profile, they may not be suitable for each and every patient. And I take a very personalized approach to counsel individual patients based on their particular needs, their desires, and also the types of the ocular conditions they may have. For example, glaucoma or macular degeneration. Now, the third group of lenses is a type of lens known as the multifocal lens, which inherently does cause a slight reduction in the amount of light transmission and something that we call contrast sensitivity. And that's the ability to differentiate between shades of color, for example. Now, in patients with glaucoma, one of the symptoms of glaucoma is an actual loss in contrast sensitivity as well. And therefore, I don't usually recommend multifocal lenses in patients with moderate or severe glaucoma. In addition, I don't tend to recommend the multifocal lens in patients with macular degeneration, which is a condition that affects the central retina, meaning that they cannot read or see faces very well. Finally, if a patient has what we call a lazy eye or a weaker eye compared to the other one, or had patching as a child or squint surgery, I tend not to recommend multifocal lenses in those particular patients.